with Dr. Alex Raymond, who's going to be talking to us about his career in pharmacy. Dr. Raymond, how are you doing today?
I'm good. And yourself?
I'm doing well as well, thank you. Kind of tell us a little bit about your background.
Yeah, so my name's Alex Raymond. Thank you for the introduction. And I'm originally from New Orleans, Louisiana. I went to high school and lived in New Orleans my entire life. I decided I wanted to be a pharmacist at a young age, and in looking for pharmacy schools, felt that Ole Miss was the perfect distance to go away for college, and offered a robust undergrad program, and really gave its graduates opportunities to succeed post pharmacy school. So the rest is kind of history from there.
Wonderful. So did you enjoy your time in Oxford? What would be one of your favorite memories?
Oh, absolutely. I did not grow up an Ole Miss fan. Actually, I kind of stumbled upon it because of my pharmacy journey and career and assessing colleges. So I had to say my favorite Ole Miss memory from attending is the Grove on Saturdays in the fall. That it's the best atmosphere in college, and also being from New Orleans too. I'd say some of the Grove days on Saturday, rival Mardi Gras in New Orleans. It's a great time, great experience, great family, friends, everyone.
Absolutely. So you've mentioned a couple times that you were attracted to pharmacy early on. Did you know pharmacists, or what were the influences there?
So I knew I wanted to be in a healthcare profession growing up. I just didn't quite know which one. There's no one in my family that's in the healthcare profession. So actually, by chance, my first job at 16 was working in a community drugstore. That's who hires 16-year-olds. And then from there, I saw how the pharmacist, not only interacted with his patients and was the expert in pharmaceutical knowledge, but also ran a successful community business, and people relied on him, everything from of course their medication, but also groceries. So seeing that, I realized that this can combine my interest of wanting to help patients with my interest in possibly running my own business one day. And that kind of set the ball rolling, that I think, pharmacy is the right path for me, and sparked my interest. That in a mixture with, I like the sciences in high school. I like the biologies and the chemistry. So, pharmacy was easy to kind of gravitate to after those two experiences.
So Alex, would you mind telling me a little bit about your pharmacy background?
So I like to think that I have a unique pharmacy background. I started working in a community pharmacy in undergrad on the Gulf Coast of Mississippi. And unfortunately, that community pharmacy then got sold to a larger pharmacy, and I started my then career with Rite Aid. Rite Aid was able to provide a internship opportunity to work at their corporate headquarters. One of those things that you apply to it, you think everyone applies to it. If you get it, great. If you don't, you still got your pharmacy job. Well, I applied to it, and lo and behold, I spent my summer working for Rite Aid Corporate in Camp Hill, Pennsylvania, developing their specialty pharmacy program. So that really was able for me to see pharmacy from 10,000 feet up in the air, and really sparked my interest for pharmacy administration. The year after that experience, I started researching pharmacy administration residencies, and that's how I ended up at Wake Forest Baptist Medical Center. I did a 2-year health system pharmacy administration and leadership residency, where I also was able to get a master's from UNC in pharmacy administration. And it sparked this whole, administrative career that I had no idea existed 2 years prior. That really jump-started my career, and I was able to land a pharmacy supervisor job down in my hometown of New Orleans, Louisiana.
So you talked about that first job at that community pharmacy. What would you say is now, having worked in the profession for a while, your favorite thing about being a pharmacist?
I think it is the flexibility to reinvent what we do on a day-to-day basis. Everything from working in your community pharmacy to providing, sit down medication, MTM with patients and talk over their drugs and really, hone in on their therapy, all the way to hospital pharmacy, from the operations of hospital pharmacy and understanding the rules and regulations, how to run a clean room for sterile products, to rounding on BMT and oncology patients, bedded on a hospital floor. There's so much flexibility within the profession that, there's multiple areas that you might have a small interest in that you can really take and run with.
Wonderful. And with that flexibility, I think you found yourself within a unique segment of the profession. Can you tell us a little bit about what you do?
Uh, I am in a unique segment of the profession. So I started my career as a pharmacy supervisor with Ochsner Health, their Jefferson Highway campus. And one of the roles in that position was to monitor our controlled substance supply chain. So as soon as our drugs, hit the dock to when they were administered to a patient on the floor, or wasted by one of our nursing colleagues. Within that monitoring process, I found some inconsistencies, and we were able to do some big changes. Through those big changes led me to my second role, and I now lead Ochsner Health's drug diversion response and prevention program. So now, just not having one department of pharmacy, but having 13 spread out of Louisiana and Mississippi. And we'll deal with everything from making sure our controlled substance orders are coming in the door, to enacting and enforcing policies and procedures.
What would you say might be one of the challenges that you face in your role? I know being responsible for even one pharmacy would be a lot, but you have a tremendous amount of responsibility. Are there challenges that you see with that role?
Uh, Absolutely. Some of our conversations are hard with our providers and our colleagues. So having those difficult conversations around, either addiction or, not following proper policies and procedures, all the way to all the different personalities you meet working with such a large multidisciplinary team. I interact with anesthesia providers, community physicians, nurses, pharmacists, of course, and then also health system leaders and compliance people.
A little bit of everyone, if you will.
Everyone.
Well, I'm sure some of the things you learned hopefully in the program are now coming in handy. That's definitely great. Speaking of our program, what advice would you have for incoming students, either freshmen or students who are entering the professional program?
Yeah. So freshmen, my recommendation is to take advantage of your summers. So your summers leading up to pharmacy school, use that time to really work, shadow, volunteer in the profession of pharmacy. Reach out to your community hospital and say, hey, can I just, volunteer to shadow one of your pharmacists one day? Be present, ask a lot of questions, and maybe that is going to amount to an internship or a job one day. Just making those small interactions will really expedite your career and do you well in the future. So really invest in the beginning, because trust me, it will pay off in the end. As for the seniors, the road is not over. There's so many different roles in pharmacy. Do your research, understand what is the best for you, take risks. Once you're in pharmacy school, apply to that internship that you don't think you're going to get. You'll probably be surprised, and you might get it. So really put yourself out there and really see all those different areas of pharmacy. When scheduling rotations or setting up, shadow experiences on your own time, go for an area of the profession that you don't know anything about and that might make you feel a little uncomfortable, whether it's, nuclear pharmacy, infusion center pharmacy, even administration. The career has a lot to offer. And you didn't put yourself in, you didn't go to pharmacy school because you're not up for a challenge. So really, challenge yourself in exploring all the different opportunities that are available to you once you graduate.
Great advice. And speaking of challenges, I know that the COVID-19 has affected a lot of us in many ways. How would you say that COVID-19 has affected your work schedule and home life?
Yeah, so it's affected us quite a bit. Being in New Orleans right now, we were one of the hot spots to be hit. I'm actually I float between hospitals, but our office that I'm actually based out of closed down. So we are now remote and work from home. When it first started picking up, I actually went back and was doing a little of my previous job and helping with our pharmacy supply chain, making sure that our patients are getting the medication in the door, and we're able to give that medication to patients who are bedded in our largest hospital. From there, I also, my license is still active. I still do practice pharmacy on every weekend now and then. So I was actually in the pharmacy verifying orders and looking at patients to make sure their medication was dosed appropriately. So I still do a little bit of that, in times of need, and I'm able to.
That's awesome. Well, thank you so much for taking the time to share with us all that you're doing. Thank you for all you're doing in this crazy time. I know oftentimes we take for granted that pharmacists are frontline employees, and I'm always so thankful for all of our graduates and y'all's commitment to serving our community. So thank you so much, and I appreciate you sitting down with me today.
All right, thank you, and go Rebs.